Good afternoon, and thank you for joining us. Today is Tuesday, October 12th, and on today's briefing, we'll hear from Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, Dr. Nick Tomorrow, Emergency Preparedness Environmental Health Director with Milwaukee Health Department, and Dr. Smriti Kari, President of Primary Care with Children's Wisconsin. Thank you all for being here, and County Executive Crowley, we'll start with you today.
Well, thank you so much, Catherine, and good afternoon to everyone. But before I get started, I want to acknowledge that yesterday, October 11th, we celebrated Indigenous Peoples Day, which is a holiday that celebrates and honors Native American individuals and commemorates their histories and their cultures. And presently, there are 574 recognized tribes and approximately 5 million people who identify as fully or partially Indigenous throughout the United States. And as we continue the battle against COVID-19, we know that there is long-standing precedent for public health crises disproportionately impacting tribal communities. And tribal communities have experienced enduring racial inequities and historical traumas that have negatively impacted their health and socioeconomic status. And furthermore, compared to all other racial and ethnic groups, Indigenous people have the highest prevalence of a key factor for more severe COVID-19 symptoms. A study conducted in the earlier stages of the pandemic found that in 23 states, the overall incidence of COVID-19 cases among Indigenous people was 3.5 times that of non-Hispanic white Americans. And according to the Indian Health Services, more than 52,000 Indigenous people have tested positive for the virus. And so we want to recognize the strength and resilience of tribal communities as they have worked together to combat this pandemic, as well as address the underlying health disparities that have made tribal communities more susceptible to COVID-19. And shortly, we'll hear from Dr. Weston about what's been done locally to really address vaccine equity and the progress that we're continuously seeing. But I also want to acknowledge that October is Domestic Violence Awareness Month as well. And this Awareness Month was created as an opportunity to really connect and unite individuals as well as organizations working on domestic violence issues while raising awareness of those in need of resources. And over the past 30 plus years, much progress has been made to support domestic violence victims and survivors, hold abusers accountable, but also to help create and update legislation to further those goals. And a couple of important facts to be aware of as we acknowledge the impact of domestic violence in our community is that there is an estimated of 66,390 domestic violence survivors living in Milwaukee County. And every 5 days, someone dies as a result of domestic violence in Wisconsin. And in 2020, there were 51 domestic violence related deaths, including 9 child victims. And these tragedies are on the rise throughout Milwaukee County. And the pandemic only continues to exacerbate these cases of domestic violence. So if you or someone you know is in need of resources and or support, please visit weareheremke.org. Again, we are here, mke.org, or Sojourner Family Peace Center at familypeacecenter.org. We want folks to know that you are not alone and there is help available. And lastly, I just want to share a few updates as it relates to our vaccine mandate for Milwaukee County employees. As you're aware, as of Friday, October 1st, all county employees who are not members of public safety unions were required to submit documentation verifying their fully vaccinated status or completed medical, religion, or creed exemption and accommodation request form. And so the number of Milwaukee County staff impacted by this administrative order is approximately 4,060, which excludes our Milwaukee County Transit System staff and departing seasonal park workers. And after reviewing the data last week, 2,900 staff members, or 72%, have submitted either proof of vaccination or have requested an exemption. And as of yesterday, October 11th, all vaccinated employees, including those with an approved exemption, will be subject to the following additional mitigation measures, which is unvaccinated employees working in any county healthcare setting will be required to wear a fitted N95 mask when a face mask is required. Unvaccinated employees working in person in a non-healthcare setting will be required to wear a KN95 mask when a face mask is required. Unvaccinated employees working in person, full or part-time at the House of Correction, the county jail, or the Department of Youth and Family Services Detention Center will be subject to COVID-19 testing on a biweekly basis, which is consistent with our current policy, in addition to being required to wear a KN95 mask. And the current administrative order defines a completed vaccination as an individual who has completed either the 2-dose series of the Pfizer or the Moderna vaccine or the single dose of the Johnson & Johnson vaccine. And it does not include any booster vaccinations at this time. And so we're going to continue to work with each department individually to dig further into the data to ensure the information is being tracked accurately. And this will take some time. And so we'll continue to provide more updates as we can, as information is available. So I want to say thank you again for joining us this afternoon. And with that, I hand it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 250 new cases per day and about 4 deaths per day. Overall, we're seeing promising trends that are mirroring much of the country. Our percent positivity is steady to slowly declining. Our hospitalizations appear to have plateaued and our deaths are stable. We should remain cautious as we go into colder months where we know transmission can increase. Keep wearing your mask, keep distancing, keep getting vaccinated, and hopefully we can keep these trends going. This will be a busy week for the FDA, and we may see substantial changes coming to booster recommendations. On Thursday, the FDA advisory panel will be discussing the Moderna booster. Moderna has submitted evidence they believe supports the need for lower dose boosters in those 18 and older for their vaccine, citing diminished effectiveness more recently against the Delta strain. Meanwhile, on Friday, the FDA advisory panel will review a request for a Johnson & Johnson booster as well, based on findings that the second dose seems to improve the immune response and protection from COVID. Finally, yesterday, Merck applied to the FDA for emergency use authorization of its oral medication to treat people with mild to moderate COVID that was shown to decrease the risk of hospitalization and death by 50%. So we'll keep a close eye on all of those FDA updates. Now I wanted to shift to talk about equity with regard to COVID. In the spring of 2019, Milwaukee County declared racism as a public health crisis, making equity a key focus of all that we do. And when COVID began several months later, we were committed to transparency in our work to address the historical and systemic inequities that were exacerbated by the pandemic. When we launched our Milwaukee County COVID-19 dashboard, we put race and ethnicity data front and center. And it was not because we were proud of our standing in this regard. In fact, in April of 2020, the Washington Post reported us as having the largest disparity between our population of African Americans and our COVID deaths among African Americans between the 9 jurisdictions that were actually reporting race and ethnicity data at that time. Only 9 in the entire country then. Now, to put a point on this, every single one of our 15 first COVID deaths in Milwaukee County were people of color. Since the pandemic began, we, and this is the collective we, the city, the county, the health departments, the fire departments, and the health systems, we have worked to address these disparities. We've shared detailed data on cases, hospitalizations, and deaths by race and ethnicity to shine a light on the disparities. We developed a SAFER model to target areas of high disease burden and low testing to better place testing centers in highly affected communities. We've worked with local partners to provide targeted messaging to vulnerable communities. We developed the EVE model to understand and facilitate equity in vaccination. And we've ensured vaccine availability and access in our vulnerable communities, whether it's through vaccination sites, by knocking on doors, or in some cases by administering the vaccine in living rooms. With these efforts and many more throughout the community, we have seen progress. Last week, we launched the largest revision yet of our nationally recognized COVID dashboard in Milwaukee County. And as part of that revision, we included the EVE model tab, on the EVE model tab, a figure that shows percent of vaccine going to our most vulnerable communities. From that graphic, we can see that whereas in the beginning of the vaccination campaign, less than 10% of vaccine was going to our most vulnerable communities, now nearly 50% of vaccine goes to our most vulnerable. 1 in 2 first dose vaccines are going to the most vulnerable in our county. We're making progress, but make no mistake, there is more to be done. We continue to see lower vaccination rates and higher disease rates in our communities of color. But we know from national data that our populations of color are not largely composed of individuals who outright refuse the vaccine, but rather people with questions or barriers. So we'll continue to work to answer those questions and to pull down those barriers. 1 in 2 doses to the most vulnerable is great progress, but it's not the end. The interventions and the outreach will continue. And if you live or if you work in a vulnerable community, you too can make a difference. Get vaccinated yourself and talk to others about your experience. Offer them a ride to the drugstore to get vaccinated. Answer a question about vaccine side effects, or be a vaccine ambassador to keep your community safe. Thank you very much. And I will hand it to one of our most critical partners in fighting the pandemic, Dr. Damaro of the Milwaukee Health Department.
Thank you very much, Dr. Weston. I will start today by giving our gating metrics for the city of Milwaukee. Currently, we are at a disease burden of 253.5 positive cases per 100,000 people. This remains in the extreme transmission category. The percentage of positive tests is currently at 8.4% and remains in the substantial transmission category. These numbers, while still higher than we'd like, we are starting to see some decline. If we want this trend to continue, it's imperative that we continue to get every Milwaukee resident vaccinated, as well as all of us continuing to mask up when appropriately. Currently, we are at 57.2% of the city of Milwaukee adults over the age of 16 fully vaccinated. 62.5% have received at least their first dose. Vaccines remain free and easily accessible without an appointment this week. In addition to our community testing and vaccination sites at the Northwest Health Center and Southside Health Center, we have mobile vaccination teams out in the community. Tomorrow, Wednesday, we'll be at Ascension All Saints Family Health Center from 1 to 4 p.m. We will be at the University of Wisconsin-Milwaukee Union from 1 to 5 p.m. As well as the COA Golden Center from 3 to 5 p.m. We'll actually be doing COVID testing as well as COVID vaccine at the COA Golden Center tomorrow. And then on Thursday, we'll be at the Mexican Consulate from 9 a.m. until noon. Yesterday, we did open our latest community testing site. So after leaving American Family Field, and thank you again to the Brewers for really a year of accessibility for community testing at American Family Field. We opened up at the Department of Transportation Old Emissions Testing site. So we're calling this the Menominee Valley site. Thank you to the Department of Transportation for just your partnership and accessing this facility and getting it up to run very quickly. We're at 2401 West St. Paul Avenue. We're trying to increase community testing and vaccine availability with expanding hours. So we will be at this new site Monday, Wednesday, and Friday from noon until 6 p.m. and Tuesdays and Thursdays from 9 a.m. to 3 p.m. Right now, testing is available. We'll be adding vaccine as of next Monday, October 18th. Again, no appointment necessary at any of these sites. You can really save time and efficiency at the site for yourself and really help out the staff if you pre-register, if you know you're going to be going to these sites. Not a prerequisite. We can register you on site, but it really is helpful for your experience and for the staff if you register before you go. You can find more information at milwaukee.gov/COVID testing. And then finally, flu season, we are in the swing of it here. So we are starting flu vaccine today at the Northwest Health Center and Southside Health Center sites. They will be available at the same time we have the existing vaccination clinic hours, Mondays and Fridays, 9 a.m. to 3 p.m., Tuesdays and Thursdays, noon to 6 p.m., and Saturdays, 9 a.m. to 1 p.m. Again, opening up vaccine at the new site on Monday. That'll be the Menominee Valley site. So those hours kind of mirroring or giving additional hours will be, again, 9 to 3 Tuesdays and Thursdays, and noon to 6 Monday, Wednesday, Friday at the Menominee Valley site. If you are interested in getting your flu vaccine, you can visit any of those sites. That's what we have today. Thank you.
Thank you, Tomorrow. And now we'll hear from Dr. Kari.
Thank you, Catherine. So I get to talk about something fun and special. And, we've been talking a lot about the ongoing pandemic and having to remain cautious, but October is a fun month for children. And so I wanted to talk just a little bit about trick-or-treating that could happen this year for Halloween. And just talking about a few of the safety precautions we want to make sure everybody is taking. So particularly for the kids, please wear masks. That is just so important. And it's a fun opportunity for people to get creative about how to make the mask part of your costume. It is important to remember that the mask that we are suggesting for safety precautions is actually something that closes your nose and mouth and protects you from disease. So masks that come with costumes may not always do that. So it is important to sort of think through that a little bit. Being outside as much as you can is always protective. And then making sure that you have plenty of hand sanitizer so the little ones are cleaning their hands as much as they can as they're receiving the treats. The Center for Disease Control has a wonderful update document on their site where you can go to that gives you some more advice about how to keep our children safe during trick-or-treating. If you're the one who's passing out the treats, again, make sure you're using hand sanitizer, make sure you're using a mask, and if at all possible, make sure that you have individually wrapped treats for the children so that we have as little person-to-person contact as we can have during the season. And then since I'm talking about trick-or-treating, always important to remember all the other safety things around Halloween that are not necessarily pandemic related, but making sure that your costume is safe, that the capes have Velcro and not ties, that the children are wearing costumes that they're not going to trip over, that they're watching for traffic, watching for lighted or decorations that people put out, such as candles and such. So being sure about fire safety and really making sure that our little ones are safe, check the candy before they eat them, and try not to have them eat all the candy at one sitting. We always appreciate that in the pediatrician's office when they don't come in with tummy aches. So that's just something related to Halloween so people can start to prepare for that. The other thing I wanted to talk about is Dr. Weston mentioned that this is a busy month for the FDA, and we're excited to know that it seems that on October 26th, the FDA will be reviewing the data that Pfizer has submitted for the vaccination for children 5 to 11 years of age. So we do hope that that emergency approval will happen soon. And I think all of our systems are working to understand how we might be able to distribute that vaccine to the children. And we're ready to go as soon as the FDA says that we're ready to go. The other thing, I want to make sure that we are encouraging that people are thinking about the flu vaccine as well. It's been a busy respiratory disease year for children. We have not seen any influenza yet. We would like not to as we work through these next few months. And so please plan on getting your influenza vaccine as well as your COVID vaccine. People have always asked us this question about, can you do it at the same time? And yes, you can. We have been advised by our immunization councils that that is safe to do. And certainly last year, we gave out plenty of flu vaccine when we had numerous children with COVID as well. And so we do believe that this is going to be the best way for us to go. Certainly, as you're looking for vaccines, you can separate them out, and the vaccines are readily available for children at numerous sites. We hope that the 5 to 11-year-olds will have that available as well when they become approved. So highly recommend getting the flu vaccine. Anytime now is a good time. And for children who are behind on their vaccines because of missed appointments last year, this is a great time to just make sure that they're getting all their vaccines. And so we'd love to see them for well visits and for vaccination in their pediatrician's office. So I'd advise any family to connect with their primary care doctors if they have any more questions and concerns about vaccination. But this is a great time to make sure that everybody's healthy with everything else as we work through the pandemic. Thank you.
Thank you, Dr. Curry. Our first question is actually for you, Dr. Curry, from Ben Wagner with WISN 12. Dr. Curry, he's wondering, can you speak to the disease burden you're seeing in kids? Have numbers stabilized?
Sure, that's a great question. And actually, if you look at the Children's Wisconsin social media sites, we have been weekly putting up an update of the numbers that we're seeing in our children's setting. So we have noticed over the last 2 weeks that we are seeing fewer cases of COVID. So it seems to have plateaued. Unfortunately, not quite as low as it was earlier in the summer. So we're still at high numbers, but definitely has plateaued. Our bigger really issue for the pediatric services is the other respiratory viruses, the respiratory syncytial virus, and we typically is filling our hospital and our clinics. And so we're still very busy in the emergency room, urgent cares, primary care offices, as well as the hospital.
Thank you. Our next question is from Ben Wagner with WISN 12. Again, maybe Dr. Tomorrow, we can start with you and others chime in if there's additional context. Ben is wondering, has there been any discussion about expanding COVID testing hours? They've heard from someone who says they can't get tested without taking time off work.
Sure. Yeah. So I do hope that, announcement of this new site we will be there 5 days a week at the Menominee Valley site. And we're trying to increase testing hours from offering, 9 a.m. to 3 p.m. at the health centers on Monday, and then we'll be 12 to 6, for an example. So really on most days, we'll have availability from 9 a.m. to 6 p.m. Ben, Mr. Wagner, if you're referring to later into the evening, right now, especially when you think about the community testing sites and as we head into colder weather and the evening hours with darkness, for our staff, we've been committed to kind of cutting off at 6 p.m.
Thank you, Tomorrow. Those are the questions I see in the chat right now. So I'll just give it one more minute in case there are any other questions for media joining us. Okay, seeing as we do not have any additional questions in the chat, that concludes our briefing for today. Thank you everyone for joining. We'll see you next week.
Thanks, everyone.
Thank you.
Thank you.